Do you want to find the number one reason why your child may have plateaued or seen little to no progress so far in PT and OT and is getting further behind in their motor milestones? Are they struggling to sit up, crawl, or walk despite months of traditional therapy? Do they seem to fatigue easily, slouch constantly, and avoid physical activities altogether? If this sounds familiar, you're not alone. Many parents are left frustrated and confused when their child's gross motor delays continue to be a challenge even after countless therapy sessions and home exercises. But what if we told you that the root cause of your child's challenges might be something that's often overlooked by traditional pediatric therapies? The real root cause of gross motor delays in kids goes way beyond low tone and a weak core, and we'll break down exactly what that is in this video. This video is for parents of children with gross motor delays who have tried traditional therapies but haven't seen lasting results and are seeking answers as to why their child has plateaued or become stuck with their progress and want to learn how to get back on track. Gross motor skills are incredibly important. They involve movements that require the entire body and are essential for daily activities and overall development. While these movements are primarily made up of the large muscle groups like the arms, legs, and core, way too often a foundational and crazy important set of nerves and muscles are left off this list. When it comes to gross motor skills and development, those of the neck and neurospinal system are what we forget about. Our gross motor development happens in stages, starting with head and neck control for latching and nursing. Then it goes to the trunk and the thoracic mid-back region to allow for tummy time and learning how to roll over. From there, the child learns how to activate and use their core in order to sit up, which then leads into army crawling and regular crawling, which are essential for brain development. Finally, some of the scariest ones for some parents, but the coolest as well, is they learn how to furniture cruise and then walk. The nervous system, specifically our neurospinal system, plays a crucial role in gross motor function and is easily the most overlooked aspect of this important conversation. The very first thing to develop in utero is the brainstem and spinal cord, because for the first moments of life, the brain and central autonomic nervous system will control every single movement of muscles, heart beating, lung breathing, food digestion, and so forth. Therefore, if we are trying to get to the root cause of any neuromuscular or gross motor problem, we can't focus solely on the muscles. We've got to address the neuro part first and foremost. That's the reason why it's neurospinal system, neuromuscular system. From there, once subluxation and sympathetic dominance or increased tone set up shop in the neck and neurospinal system, most commonly caused by things like breech positioning, birth interventions like forceps, vacuum induction, or C-section, that hyper or high tone will stay stuck in those regions until adjusted and cleared out of the way. This means the original cause of low tone or weak core that you've heard about for your kids is actually tension and subluxation in the neck and the neurospinal system, which we can find on our examination analysis, and especially one of our scans we do in the office called the EMG scan. So if your child has been struggling with gross motor delays and you feel like you've tried everything without lasting results, it's time to look deeper and find out if subluxation, excessive sympathetic tone, and things like the lasting effects of birth trauma could still be at play. To find out how your child's gross motor function is doing down to the very core, call our office or visit our website to get scheduled for your neurological scans. Once we have these scans, we can then create a truly customized and fully tailored adjusting care plan made specifically for your child and finally get them past that plateau or stuck point that they're experiencing and back on track with their gross motor development.